The head of the medical team that treated Pope Francis during the 38 days he spent at the Rome's Gemelli Polyclinic Hospital, Dr. Sergio Alfieri, revealed that one of the most critical moments of his hospitalization was when they had to choose between continuing the therapy or letting the Pope die. We had to choose whether to stop or let him die, or push it and try every drug and therapy possible, running the extremely high risk of damaging other organs. In the interview, Alfieri described in detail the doctor's response to the respiratory crisis suffered by the Pope on February 28. According to the medical report published that day, Pope Francis suffered an isolated attack of bronchospasm, a severe coughing fit that suddenly worsened his clinical condition after days of moderate optimism at the Vatican. Although the Pope never lost consciousness and cooperated with the specialist therapeutic maneuvers, the alarms went off, and doctors opted to place him on a non-invasive mechanical ventilation mask to help him breathe. I saw tears in the eyes of some people who were close to him. For the first time, I saw tears in the eyes of some people who were very close to Pope Francis, people who I have come to understand during this period of hospitalization truly love him like a father. We were all aware that the situation had worsened further and there was a risk that he might not make it. However, despite the risk of causing irreversible kidney and bone marrow damage due to the medical treatment he underwent, they decided to act. We really thought we wouldn't make it. It was a difficult situation, as Alfieri recounted, ultimately supported by the decision of the Pope himself, who through his personal health assistant, Massimiliano Strapetti, his personal nurse at the Vatican, gave a clear order: try everything, let's not give up, and no one gave up. In the end, Pope Francis responded to the treatment. However, after his recovery, there was another moment of intense concern. While eating, the Pope suffered an episode of vomiting, and gastric juices ended up entering his lungs. We were just coming out of the toughest period, and while eating, Pope Francis vomited and inhaled it. That was a second truly critical moment because in these cases, if you don't act quickly, there's a risk of sudden death, in addition to complications in the lungs, which were already the most compromised organ. He might not survive the night. The doctor explained that despite the seriousness of the situation, Pope Francis was always fully aware, even when his condition worsened. He was aware, like us, that he might not survive the night. He added, "We saw the man who was suffering. However, from the first day he asked us to tell him the truth and wanted us to tell the truth about his condition." I agreed to receive other communications from EWTN in this regard. The director of the medical surgical department at Gemelli Hospital expressed the desire for transparency that prompted the Vatican to report on Pope Francis' health. We communicated the medical information to the secretaries, and they added other information that the Pope later approved. Nothing has ever been modified or omitted. The power of prayer. In the interview, Alfieri also highlighted the Pope's incredible strength, both physical and mental. In the past, when we spoke, I would ask him how he managed to keep up this pace, and he always replied, "I have a method and rules. Beyond the very strong heart, he has incredible resources." In addition to Pope's stamina, Gemelli medical coordinators added that the prayers offered by faithful around the world in recent days also contributed to his recovery. There is a scientific publication that says prayer strengthens the sick. In this case, the whole world began to pray. I can say that twice of the situation was lost and then it happened like a miracle. Of course, he was a very cooperative patient. He underwent all the therapies without ever complaining, he stated. We thank God for the health of our Pope. Glory to Jesus.